Winter is coming and pressure is mounting.
The role of paramedics has changed a lot in the last few years. 10 years ago, ER closures were nothing that was even on our radar that paramedics would be asked to help bridge the gap.
So far in 2025, there have been more than 250 separate hospital and emergency room temporary closures across the province, meaning the weight on paramedics grows heavy as the only accessible healthcare provider in some communities, navigating long transport distances, severe weather, and record call volumes.
As we go into the harsher weather in the holiday season, the pressures and the staffing are never as good either. So we're anticipating more closures and it to ramp up a lot in the next 6 weeks.
And the city of Delta is no stranger to overnight closures, with the ER having faced now 4 major interruptions in recent months, with Mayor George Harvey expressing concern for ambulance times in the community.
Delta, for urgent calls, life-threatening calls, has the highest response time in Metro Vancouver. And I really feel for the paramedics because they have to do a transfer of a patient in Delta. It takes a very long time.
Last Friday, Delta Council hired a consultant to look at building its own urgent and primary care center to address the gaps, something already being done on Vancouver Island in Colwood.
They feel that the movement of having local governments run their own clinics when it's necessary is going to lead to a lot more doctors wanting to work in that environment.
Meanwhile, the Ambulance Paramedics of BC continues to negotiate its contract with the province to stabilize the paramedic workforce, focusing on retention, recruiting, and training, with the Ministry of Health saying in a statement, "There is a global shortage of healthcare workers. This is why we continue to train and hire more healthcare workers in BC than ever before. Our initiatives include fast-tracking credential recognition, expanding the UBC Medical School, and establishing a new medical school in Surrey." Noting that total emergency department closure hours are down by around 25% compared to last year. But with winter weather and holiday traffic in the forecast, APBC urges people to be prepared if or when an ER closes.
We're doing everything we can to staff as many ambulances as we can over the busy holiday season. But the reality of it is there has to be, a contingency plan in place.
Encouraging folks to know where the closest available hospital is if your local hospital is closed. In Vancouver, Sarah Jones, City News.